think it's a one scale of magnitude less than usually takes to organize these things. Welcome, we start. The second, I have two comments before starting. One is that health technology assessment is much more present in this global forum, and I'm very glad for that. And the second is that there is also a meaningful change in the name of the sessions, because much more sessions are related to health technology assessment, but this time is assessment of medical devices. And I think that this is a good sign of the difference between health technology assessment in pharmaceuticals and health technology assessment for medical devices. So let me start now. I would like to invite Leandro Pecchia, representing the Health Technology Assessment Division of IFMBE, to tell us about the role of biomedical engineering in assessing medical devices. Leandro.
Thank you, Nicholas. Thank you, Adriana, and thank you all to be here today. I share the enthusiasm of Nicholas because it's an honor to be here. So I'll try to be in time. So I've been asked to give this talk about what is the role that biomedical engineers may have in order to support the multidisciplinary community which is putting effort in health technology assessment. Why am I here? Because I am part of the International Federation of Medical and Biomedical Engineering, which is the World Society of Biomedical Engineers, which, apart from many others, committees and working groups, has only two divisions, one of which is health technology assessment. And that's important because these reveal how important is health technology assessment for the world community of biomedical engineers. I'm proud of that because the situation was not like that 10 years ago. Now, within this division, we start from this assumption, which is not our statement. This is an official document which is into the official journal of the European Union, and it states that biomedical engineering is not simply a subset of modern medicine, but it is modern medicine which predominantly achieved the main results in the last few years throughout the products of biomedical engineering. Now, we can spend words on that, but I think images are much more powerful. Don't take me wrong, medicine is not changing in substance. The patient is there, the medical doctor is there. What has changed has been the environment in which this is done. And this environment has changed because of medical devices, which is why we are here. And biomedical engineers, I think we have a significant role in maintaining and produce and sustain and promote and assess this kind of innovation. Now, in this framework, the Health Technology Assessment Division of the IFMBE has this vision that all biomedical engineers should make an effort in order to be more supportive to other professionals which have an interest in health technology assessment. And in our vision, there are good reasons why they should do that. The first one is that they have a peculiar know-how. We are skilled in research, design, assessment, and maintenance of medical devices. Because when we train our students, we don't know where they are going to end up. And that's really important because they've grown up having an open mind towards all the life cycle stages of a medical device. And then they end up, as I said, in different environments. They may work in research and development, manufacturing, hospitals, agencies. So they have the perspectives from both sides. And perhaps that's a peculiarity which is typical of biomedical engineers in this moment. Last but not least, they have a very interdisciplinary background. We are trained in, obviously, engineering, physics, math, and stuff like that, but also biology and medicine, which is very important because you can talk to us, we try to understand. And that's not trivial because in any multidisciplinary effort, this is a significant drop down. We focused on several areas, but I will not enter in details. I will just tackle two of the things, and I will stress that all those information are on our website. The link will be on the publications at the end of the presentations. And basically, when it comes to guidelines, we start from those assumptions that medical devices are too dependent from their operational environments in order to be treated as medical devices. as drugs, which means that they require a specific approach in order to be assessed. They have a too short life, which means that health technology assessment has to inform the design of medical devices. Otherwise, we would not be in time to design, produce, and commercialize sustainable medical devices. So if they're delivering drugs, we need to do something before they enter into the market. And last but not least, medical devices are too complex in order to be assessed, considering only few dimensions, which means that there is a huge need for other methods, multi-criteria decision analysis, and much more. Now, those are our main three concerns about health technology assessment of medical devices. That's why we are working on 3 white paper, and if we will be good enough, guidelines on those 3 points. We are working, producing a white paper on health technology assessment of medical device, health technology assessment of medical devices in a pre-market stage, early assessment, predictive assessment, pre-market assessment. This kind of assessment is not yet very well standardized, so there are different boards. And the last one is about multi-criteria decision analysis in health technology assessment, which should be published by the end of this summer. Just to give you an example, I just finished to give before a presentation about medical devices in low-middle income countries, where you understand clearly that the dependence from the environment is important. And this is my last slide. We are organizing a lot of training, e-learning, summer schools in order to train biomedical engineers in this area.